The topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Houston. Welcome to another Ask the Expert show, the 16th year with Ask the Experts. We're on probably more platforms than any other show in the country. We are on 75 platforms. There's so many ways that you can get to our show. We have a very special show for you today. It's so special, we're going to replay it on Monday at 9 o'clock Eastern time. It's such a big show. Hey, let's get started. Let me introduce you to our expert, Dr. Joe. Good afternoon, Dr. Joe.
How's it going, Steve?
Good. So we're going to be talking about denying medical claims.
Yep.
Wow.
The way you've never heard it before, I can tell you that.
How long have you been working on this for?
I've been doing this, I've been doing medical claims for 20 years, but I've been doing it the way gathering the information I know now for about a decade. And I want to start sharing that information. Actually, I don't know if you watch the nightly news, but this past week or month, they have a whole segment called The Cost of Denials, if you're familiar with that at all. But, it's amazing. Every night or once a week, whatever, how often they're doing the show, they, interview a family or a patient who's been denied a medical benefit by their insurance, usually because it's supposedly not medically necessary. And then lo and behold, after they air it on national TV, suddenly the what wasn't medically necessary has somehow magically become medically necessary, and they're happy to report that so and so has rethought the claim and is not going to cover the service. Either something is medically necessary or it isn't. It doesn't change because you're on national TV or because someone hears about it, or you want to protect your reputation. So if you think about it, every lab order for an X-ray, physical therapy, for an operation, they're called orders because they're ordered by a doctor who has a license and typically a board certification to order those tests, right? And I would like to think, and I know we're not all angels, but I would like to think that most surgeons, physicians, are ordering things that are necessary. I don't think you believe your doctor is ordering things and having you take things and prescribe things that aren't necessary.
Right.
And yet somehow, insurance companies find a way to deny it as not medically necessary. So imagine you have a bucket, full of denied medical claims. Let's just focus on medical necessity for now. What percent of that bucket do you think is legitimately not medically necessary? In other words, what percent of that bucket are doctors just ordering stuff people don't need? And what percent do you think they're needed, but insurance companies find a way to not pay it? I would argue, based on what I've learned over the last decade, that at least 90% of those denials are fraud. And
what percent?
10% of those are legitimate, 90.
Wow.
The majority. I mean, I'm sure there are some physicians out there ordering things that aren't necessary, but I don't think it's the majority of claims, that are not being covered. So the problem with, what's interesting is patients don't believe that they have rights, and patients actually have very strong protections under the federal law on how claims are argued and reviewed, rights to look at information, review all the records that are produced or created in the processing of their claim. And because insurance companies have made the process of claims so complicated that they literally can defraud you right in broad daylight. I mean, think about it. Most patients don't even know the definition of deductible, coinsurance, out-of-pocket maximum, and copay. They don't really understand the complete, in-network, out-of-network. I mean, I haven't even talked about a benefit yet, other than benefit limits. Now you want that same patient to argue that something they think they need and insurance says they don't need, they actually need. What's the chance of that going to be successful? It's like going to a courtroom and the other side has 100 lawyers and you don't have one lawyer.
Yes.
And the irony is that patients, I guess it's the ignorance, and I don't mean it in a derogatory term, but they think that their doctor knows how to do all this stuff. They think it's the doctor's job to do all this stuff, like you're going to make the money on it. You should be getting my approval for surgery, but it's your surgery. It's your medicine. It's your therapy. It's your lab tests. Patients don't know the rules, and doctors don't know the rules. And think about, our staffing, doctors don't employ PhD billing specialists. In fact, there is no bachelor degree in medical claims billing. There is no master's degree in medical claims billing. There's no PhD offered in medical claims. The whole industry is it's like a apprenticeship. The way that people who work in the industry learn about the industry is like a hand-me-down. So, and I choose these names for a reason. I'm sure it'll be obvious, but it's like Dorothy or Helen taught Kathy, taught Betsy, taught Brittany, taught, whatever the latest name is now for a girl or boy. It's a hand-me-down of information that's all propagated by the insurance company. Who are these people calling when they can't get something paid? They call the person who didn't pay it. And then patients actually think that the person on the other end of the phone wants to pay it, and that they're going to tell you all the things that you need to do to get it paid. And think about how crazy does that sound? The person who's going to write the check, who told you they're not going to pay for it, is now going to suddenly tell you what you need to do to get it paid for after they just told you they don't want to pay for it? Do you really think that happens, Steve?
Well, we have it. One of our shows we used to do, it was a health claims attorney. Yeah. And all she did was go through hospital bills, not doctor bills, but hospital bills, and would find all the things that were wrong with it and the ones that didn't want, and the insurance companies. She made a pretty good living.
Well, I've never met an attorney that knows what I know. In fact, I've used attorneys to enforce rights, but I have to tell them, everything they need to be arguing, and then they know the law and how to fill out the forms and process it through the system. But it's a shame that patients have all these rights. They don't know they exist. I'm going to tell you what they are in a minute. And even if they knew their rights, they wouldn't, they're not taught or know how to exercise their rights. So in fact, they have no rights because they don't know the rights they have, and the rights they do have, they don't even know how to exercise the rights. But I think of your rights with claim denials is equivalent to your Miranda rights when you're arrested or convicted of a crime. You can kill someone, and if you're not read your Miranda rights, you go free in this country. If you're not afforded due process, we in this country value process over the fact that you're going to walk free from killing somebody. That's how important due process is. And believe it or not, we have those same, we don't, patients. And that's another point, is that when your doctor is arguing your claim for benefits, doctors don't have any rights. They're not the doctor's benefits, they're the patient's benefits. The federal government doesn't protect doctors for appealing your claim denials. The federal government protects the patient, the beneficiary's rights. And so when your provider is appealing on your behalf because you think they know what they're doing, when in fact they really don't, sadly, and the ones that kind of know something, the problem is they're basically doing it with two hands tied behind their back because they don't have any of the protections that are afforded to the patient because they're not the patient. And the insurance companies know that. There is a way to do that, but there's a law out there, it's called ERISA, which is an acronym, ERISA, and the statute is 29 CFR 2560-503-1, 29 CFR 2560-503.1, and that's the Federal Code of Regulations, claims and appeals procedures that every insurance must follow when they're processing your claim for benefits, what notifications they have to give you, what your rights are if you're denied, if you appeal, what rights you have. And nobody exercises those rights properly. And the irony is a lot of your explanation of benefits, which no patients or few even know how to read their explanation of benefits. But at the end of that explanation of benefits is a section where the insurance company, because they're required by law, will actually print out sections of that statute to tell you your rights, but nobody understands them, so no one actually executes them. And so it's like, it's like signing an agreement, but there's like 1 point font and you can't read a single thing in the agreement, and you sign it anyway. And then they say, see, I told you right here. These are all the things we said you agreed to, but you never really read it because you couldn't see it. And even if you could, you wouldn't read it or understand it, I should say. So the things I've discovered and I've proven over the decade, I've found, for example, procedures that an insurance company was saying was experimental. And then in order to carry out that fraudulent denial, they went and paid a doctor who actually performed the procedure to write a letter claiming it was experimental for the patient that was having the claim denied.
Oh my gosh.
I have all the proof
Wow.
of that. I won't put it out there for you, but so imagine you are going to have an operation, and that operation, your insurance company says is experimental. In order for that company to uphold that denial, they have to find a doctor, this is what the law says, who's trained and experienced in the field of medicine that they're opining on. Okay? So that means you can't have a toe doctor opine about your C-section. Okay? It seems common sense, but they do it. So,
hey, Dr. Joe, can I get a question in? Someone just wrote and said, this is a great show. Thank you, and thank your expert. I have a question. I went into a major hospital because I was having a knee replacement. My insurance company okayed the surgery. After the surgery, I got a bill for $75,000 from the hospital.
mm,
The insurance company said they did not okay it, but the hospital had to okay it in order for them to do the surgery. Now I got stuck with a $75,000 bill. Have you heard of things like that?
I've heard of everything. So there's again, when people give you information, what's really important is on the explanation of benefits. There are going to be codes on there that tell you the reason that you're not being covered. And covered doesn't mean paid. And that's a problem that I teach my staff, is to not use the words pay with a patient, because when someone hears the word pay, they literally think it means pay, like they're going to write a check.
Right.
The better word to use is covered.
Okay.
So, and again, this is very basic stuff. This is just math, and it's the most simplistic, understanding of insurance. And this is the problem right here, Steve. I mean, we're talking about something so simplistic as the bill, but the question is, first of all, if something's covered or not. That's what you want to know. If it's covered, then that means that the charges will apply, whatever's allowed will apply to your benefit level. So let's say something's covered and it's, $500 and you have a $5,000 deductible. Well, yeah, your insurance will cover that $500, but the patient will pay the $500 because the patient must contribute their $5,000 before the insurance contributes a penny. Okay. Again, this is like 101. This is the problem in this country right here. Like
The people don't know this, so
having to explain that is sad, but a fact of reality. Now, when you go to a provider, so the first question is, was it covered? Because if it wasn't covered, then you have to know what is the reason that they're not covering it, which they have to tell you. Okay. So sometimes there's something called, you have to get authorization. You have to ask ahead of time to do the procedure. You have to provide the insurance company with the codes, and you have to provide them whether or not you're going to do it at a facility or you're going to do it at an office, and then tell them which facility. And then they can do one of two things. They can deny it or they can approve it. And if they deny it, then they have to tell you why they're not approving it. And if they approve it, then you don't care why they're approving it. All you care is that they're approving it.
Right.
Now let's pretend that these services were approved. And the next question will be, really comes down to money, because once it's approved, it's covered. Then the question is, how much are you going to pay? How much is your insurance going to pay? There's the word pay. Okay. It's covered. Now who's going to actually write the check? So if you go to a network provider, that means they have a deal. The insurance company and that provider have a pre-agreed amount for every single thing that could possibly be done in that hospital that has a code. Okay, everything we bill is in codes, and that it's like, hey, a widget is normally $10, but you know what? We have a deal. It's only $2 for you. So if you go there, it's going to be $2 because they have a deal, which that's what's called being in network. All right.
Okay.
But if that facility doesn't have a pre-negotiated deal for all the prices that they're charging, then that's called out of network.
Okay? It's called what?
Out of network.
Okay.
Out of network does not determine if you're covered. Covered is a determination of your benefits. Like, we cover boob jobs. We don't cover boob jobs. It doesn't matter in or out of network. You either you have insurance to pay for your boob job, or cover your boob job, or you don't. Normally, people know boob jobs are not covered. It's considered plastic surgery. That's why I use that one. Everyone knows, your employer isn't going to pay for your double D tits. Okay, it's not going to happen. All right. So, but if you have appendicitis, people would generally agree that's a medical necessity emergency that needs to be treated, and therefore will be covered. Okay. You follow me? You're reading.
Yeah.
All right. So then the next question, so it comes to if it's in or out of network, and all that determines is the amount of money that's going to be up for, need to be paid at some point, whether it's pre-negotiated discount amount or a unnegotiated amount. Okay. So if this surgeon for the knee replacement, if that was a covered procedure, then it's covered.
Okay.
And then the question is, was it performed at the facility where the doctor told them it would be performed ahead of time? The insurance does a really good game with patients. It's really terrible. What they'll do is let's take the person who chimed in with the knee replacement.
Okay.
What the insurance will say is that no auth is required. Okay. They'll say you don't need permission. Go ahead, do it. We don't. But what that does, I want to make this very clear to everybody. No auth required does not mean covered. Let me say it again. No auth required does not mean I will cover your surgery.
Wow.
No auth required means, and it means this and only this, as a condition for coverage. To even be considered for coverage, you have to ask me first. So, do you hear what I said? As a hurdle to even consider being covered, you have to ask me first. If you miss that step, so if they require auth and you don't get it, it doesn't matter why you had surgery, you will not be covered.
But how do you know that? How do you know to ask?
Because you're supposed to contact them. So there's a lot of games that go on. You're supposed to contact them, and they'll tell they're supposed to tell you whether or not those procedure codes require auth. And sometimes they tell you wrong. Sometimes they're telling you it doesn't, but it does. You see the problem?
Yeah. I mean, here's the guy at the hospital said, yes, you're covered. It's going to be taken care of. They do the surgery. He gets done with the surgery and he gets a huge bill saying it was.
But again, we don't know what was it covered or was it not covered? And then if it was covered,
why would they do the surgery if it wasn't covered?
Because again, I just told you, maybe it was no auth required, and then they did the surgery, and then the insurance after the fact says, "Oh, we're not going to cover it. It wasn't needed, or we didn't meet this, whatever." They make up a reason.
Right, okay.
And so now let's play out that scenario. No auth required. Surgeon's dumb enough to go do it anyway.
Yeah.
Okay. You do the surgery. Then look, surgeon did the surgery. Patient got the surgery. No one gets paid. It's a win-win for everyone but the provider. Right? Patient got his new knee. He's happy.
Right.
Insurance didn't have to pay for it. They're happy. Providers like, what just happened? Facilities like, what just happened?
Yeah, but the doctor shouldn't be happy.
No, he may not have got paid either.
Yeah.
Maybe in this case he did. But the problem is, I hate it when there's no auth required, because that means they're not going to guarantee at least the necessity of the procedure ahead of time. If you get an authorization, then that's done after the insurance reviews medical records, and then at least you have in writing that your insurance company deems what you're having done to be necessary and covered. Do you follow me?
Yeah. What we're getting a lot of 1, 2, 6, 7 texts all wanting to know if you can beat the insurance companies. Because it's kind of a David and Goliath.
I beat them all the time. That's why I get retribution. That's why I'm anonymous, because they're doing what's illegal. I catch them doing the illegal, and then to retaliate, they kick you out of networks and things like that so that you don't get patients. That's what they do. So
they can do that.
Well, yeah. There's nothing illegal about not having you in their network. Right?
Wow.
A network is just an agreement for pricing. There's nothing else about a network. People think that, there's a lot of propaganda out there. Don't go out of network. Oh, you're going to get screwed. You're getting screwed by not choosing doctors based on who is good and who does what that you like. Doctors will negotiate with patients. Healthcare is not as expensive as and I know this guy got a big bill, but the charge masters are not representative of real money. Okay. I mean, Tylenol's, $100. Those aren't real dollars. Okay. Look at any in-network. Let's take that bill for $75,000. I bet you if you had an insurance contract, it would be $6,000 or $7,000 real money, And what patients don't appreciate is that if you went to the hospital and said, look, I got $7,000 cash right here, you give me the same deal, they'll be like, hell yes, we will, because they don't want to deal with all the BS either. So, people think that surgeons get tens of thousands of dollars to do surgery. We don't. We don't get that kind of money to do an operation. Cardiothoracic surgeons get, $3,000 to do a bypass operation. It's terrible. You'd think that'd be 30 grand or 50 grand to crack your chest open, stop your heart, replace your blood vessels, sew you back up. It's a few $1,000s. The hospital gets $100,000, not the doctor.
Here's a text from Sugarland. They said, I got steri strips done and I got a bill for $280 for steri strips. And I tried to fight the insurance company and I got nowhere. How do you get through with these insurance companies?
Well, again, that's a problem with any of these questions. I hate to say it, but the devil's in the details. And the only thing wrong than no information is misinformation. When you go into a claims appeal process, it's like going to the courtroom. That's really how you have to view claims appeals, because every patient in this country that has a claim filed through an insurance company has the right to sue them in federal court if they're not happy with the decision after they've exhausted the appeal process. That's written in the federal statute that I've read to you earlier. Okay? That's the federal government telling you that if you're not happy with your appeal, you have a right to sue. The issue is that when you go to have a judge review whether or not the insurance company abused their discretion, right? They abuse their power to determine whether or not something should be covered. They can only review the records that you've accumulated during the appeal process. You can't go in there after the fact, a year later and start drudging up details and facts. They won't look at them because they're only allowed to review what was presented at the time of the claim and during the appeals process. Okay. And what's very powerful about ERISA is that patients have a right to review every single document, email, transcript that was generated in the course of their claim processing by law, free of charge. If you get denied a benefit, you can write your insurance, write your employer if you're self-funded. That's another avenue that most patients don't understand. 80% of people in this country are insured through a self-funded plan, which means if you work for Shell, ExxonMobil, Apple, Minute Maid, you name the big company, those guys have boatloads of cash. They don't need Aetna's or United or Blue Cross's money. What they need are the claims administration services. So when you have Shell and Shell uses United Healthcare, you don't have United Healthcare insurance, you have Shell insurance. People don't understand that. And Shell and all of these, they're called plan sponsors, they have the duty, the legal obligation to make sure that you're not getting screwed over in the administration of your benefits. So ultimately they're responsible. They'll tell you they're not responsible, but they are. So if you go to your employer, they're always like, oh, we don't do the claims. You have to call United. You got to call Aetna. Well, what you want to tell them is look at 29 USC 1105. That's co-fiduciary duty. 29 USC 1105. It's called co-fiduciary duty. A co-fiduciary means that, first of all, a fiduciary is like your mother. Hopefully you got a good mother, Steve. And your mother is supposed to do what's best for their child. And your plan is supposed to do what's best for you as their beneficiary, okay? So that would mean they can't defraud you, right? They have to help you. But that's not usually the relationship you're going to get. You're going to get the go fuck yourself, talk to United Healthcare is what you're going to get. Or talk to Aetna, talk to Blue Cross. We don't do that. We pay for that, And they do pay for that. And I understand why they feel that way, because they pay a lot of money to have these companies administer their benefits for their employees. I mean, heck, you got 30, 40,000 employees, their job is drilling oil. Their job isn't processing your, tonsillectomy or your appendectomy. That's what they hire these guys for. But that doesn't mean they're not responsible. And so you have to see the thing about law, Steve, and the enforcement of your rights is that if someone knows you don't know your rights, then it doesn't matter if you're right or wrong. They're not going to do jack shit about it.
Right.
The same reason, I mean, think about it. If you could drive around Houston at any speed you want and you get a ticket, but you know that they're never going to enforce that ticket, you're going to drive however fast you want.
Right.
Okay. You have to be right, number one, and you have to have a remedy, number two. By remedy, I mean they have to know that you can sue them and you're willing to sue them, and you'll go out and get a lawyer and you will sue them and you'll win. The nice thing, and what I love about what I do, is I know before I start if I'm right or wrong. This isn't a car accident. This isn't, bystanders. No, he ran the red light. No, actually that guy, he turned first. And then the other. You're not trying to recreate the scene of some crime where there weren't any cameras. And it's a he said, she said. This is a factual claim. Everything is about the facts.
How time consuming is it, Joe?
Very. Of course, it's time consuming because
So
you have to.
Each claim that you have have.
Right. And then that's how they get you, because they know you're not going to argue over $50, $100. So now imagine how many claims are being processed per day in this country. I don't even know the number. I mean, it's what, millions of claims a day, right? There's millions, hundreds of millions of people. How many claims a day? It's ridiculous. What if you could steal, $50 a claim, or $20 a claim, or 100 here and 500 there and 200? How rich would you be?
Wow, yeah.
Just look at healthcare costs have gone up exponentially. It's the number one. Look at the last CPI report. Healthcare is going up faster than any other. Insurance in general is going up faster than any other expense in this country. And yet, how is it that Cigna stock, United stock, Aetna stock, how are all their stock prices at all-time high? I know United got hit recently, but still all-time. How are their graphs look like ski slopes going up? If supposedly healthcare has just become so expensive, and it's simple. They don't pay. They collect and they don't pay, and they steal and they do it day in and day out. And it's sad, but it's, if you don't know your rights, that's on you. That's on you.
Most people don't, do they?
Nobody does. Not a single person knows what I'm telling you right now. I'm telling you, no one knows. That law has been around, I think, I'm going to misquote myself, 68 or 73. I mean, that's how long ERISA has been around. That governs rights for claims administration, and not a single person knows what the hell I'm talking about. You have to know your rights. And what's cool about the claims and appeals process is you don't need a lawyer, because you have all of the discovery rights are given to the patient. You don't need a lawyer to argue your benefits. You just need time and knowledge. And if you are persistent and you're right, eventually you're going to win, because no one's going to go to the courtroom when they're wrong, and they know that that you're right.
Someone just wanted to know what your success rate is from these claim denials.
Well, that's a loaded question. I only argue when I'm right, and when I'm right, I win 100% of the time. But you're right from the beginning. You don't have to do a lot of work to find out if you're right. That's the beauty of it. You can find out if you're right easily. Do you follow me?
Oh, absolutely.
If you know what you're doing, you're going to know if you're right at the beginning. Let me give you a quick example. Real simple. They do this all the time. Let's say that you're a provider, you need an operator. I'm going to use surgery. It could be a medicine, it could be physical therapy, it could be long-term acute care. I don't care what the service is. That's another beauty of it. Once you learn it, it applies to every single claim, period. It doesn't matter what you're arguing about, which is beautiful. Let's say that you need, you have a kidney stone removed. Okay, you need a kidney stone removed, Steve. And your doctor, on your behalf, because that's the way this country's set up, and that's how the contracts between the doctor and the insurance company are written. That's another fraud, is the contract that the doctor has, if they're in network, says they have to get an authorization. They're required under their contract. Your health plan may not actually require that authorization that the insurance company is making your doctor get. They're using a contract with the doctor to override your health benefit plan, which is illegal. You can't do that. So anyway, the doctor calls and the insurance, staff, Sally, the 23-year-old is doing his billing, calls the insurance company, and they tell that girl that called on your behalf that you don't need an authorization to get your kidney stone removed. Okay? It's on the phone, it's verbal. Sally calls you up, Steve, great news. No authorization required. Doctor said, go ahead and get it scheduled. We're going to go ahead and get that kidney stone taken out. You go to the operating room, you get your kidney stone taken out. Okay? Afterwards, you submit the claim. Your doctor submits the claim. Denied, not medically necessary. No, my bad. Denied, no authorization. That's what I meant to say. Denied, you didn't have an authorization. And then you're like, well, doctor, you told me I didn't need an authorization. And the doctor's like, yeah, I know. Sally told me we need an authorization. And Sally's like, yeah, I know. The insurance told me we don't need an authorization, right? Where's your proof?
You don't have any.
Yeah, you can't prove a negative, Steve, last I checked.
Right.
Yeah. It's like saying we don't have an agreement. No, yeah, we do. Really show it to me. You don't say, prove to me we don't have an agreement. You say, prove to me we have an agreement. No one ever says, prove to me we don't have an agreement. How could you prove you don't have an agreement with somebody? You can only prove materially that you do. And so,
right.
The thing is, when you call the insurance, they give you this call reference number 215869. Well, guess what? When you call them to get that call reference, we don't have any call reference number from Sally on September 11th. I don't know what you're talking about, sir. And you'll never win that one. So I wouldn't argue that one. But I'm not dumb enough to do that. So I don't.
You would not have argued that.
Of course not. How can I win?
Okay.
I can't prove that no auth was. Now, you know what you need to do is you have to make sure you get that in writing that no auth is required. Then when they deny you for no auth required, now you have it on paper. Now you can win. See? Easy one. You just show them the proof. You're denying me for no auth, and here's the auth. Go fuck yourself and pay my claim.
So you do that with all your patients?
Right.
You get it in writing?
Right. And if I don't, then I make the patient guarantee the payment.
Okay.
Because, and this is the thing, the patient will call their insurance. Pay all this money for insurance. The doctor says you're not going to give them an authorization. And then the insurance will be like, they like to put the doctor against the patient. That's their best move, is to make the doctor. We're all douchebags. And they'll say, well, that should be covered, Mr. Jones. Of course, we're going to take care of you. We love you. Your doctor should do that operation. I don't see any reason why that shouldn't be covered. Will you put that in writing? No, I can't put it in writing, but I see no reason whatsoever why that. You definitely need to get that kidney stone removed, sir. We're going to cover that. But if the patient's smart, which they're not smart when it comes to this.
Right.
They're going to then call their doctor. Well, I called my insurance company and they said it should be covered. So, I need this kidney stone removed. And they put the doctor in the middle and make him the bad guy. These aren't doctors' benefits, people. These are your benefits, okay? And you need to understand how the system is set up. And the system is set up not in your favor. You're in Vegas and they're the house, okay? And you're the guy trying to beat the system. So, but the good news is that there are a lot of protections, but you just have to know what they are and you have to learn them. And then you have to know how to exercise them. And so I'm actually designing an AI app. And once I actually have funding for it. I'm pretty excited about it, because to teach what I know to everyone is impossible. I can't even teach it to people in the field, let alone to the lay public.
Insurance companies are going to hate you.
Yeah. So once I get it set up, I'll advertise the website to you in a future show, and we'll take email addresses. And then once we get some working product, we will email people. And it will be an app that you can, ask it questions. It will generate documents. It's going to write letters for you. It's going to know the law. It's going to know, you're going to be able to upload your denial letter, and it's going to analyze it and tell you what, the strategies are to get that covered, or tell you that, you're wasting your time. That's part of the game. The game is to know when you're right and when you're wrong.
Right. You
just have to know. But when I'm right,
you mentioned a documentary when at the beginning of the show, we're getting a lot of people asking,
Yeah, the cost of denials.
what's that?
It's not a documentary. It's a new NBC nightly news.
Okay.
They're running
NBC.
called the cost of denial. I mean, they had one on there. I watched it. Like this. It was a black family. The daughter needed back surgery. She was like in excruciating pain. She had Aetna. Aetna said it wasn't necessary to have back surgery. They did a GoFundMe. They raised $30,000 to help offset some of the cost of this back surgery, which she eventually got. After she got the surgery, Aetna always said it was not necessary. And then they aired it on NBC, and lo and behold, guess what Aetna did? What do you think they did, Steve? When it was aired on NBC over the entire, broadcasted across the
They
entire
paid
world?
for it.
Yeah. Well, we decided after we had someone else look at
Yeah.
it, and we decided miraculously
They
that
had a
now it's
change of
medically
heart.
necessary.
They had a change of heart.
We're the good guys, bullshit. I'm telling you, I think I told you before the show, or maybe did I tell you on the show about the surgery? People get surgery, and then doctors that are denying the surgery for it not for say it's experimental are doing the exact same surgery, but they're signing their name to letters saying it's experimental to deny someone else the same benefit. Insurance companies are paying doctors to do that.
Wow.
So there are some sleazy doctors. We're not all, we're not all ethical, unfortunately. So I get why insurance can be the way it is, but I also have seen so much fraud that it just makes me sick. And so that's why I'm so
Can you
passionate about
imagine
this
the millions of people who just walked away from this
all
saying
the time, because
they
people
couldn't
don't.
win?
Yeah, I have a friend. I mean, she's a physician that had, I think, a knee, hip, some kind of surgery. She couldn't take care of herself. She's also a caregiver for a sick mother who wanted home health, and they said it wasn't necessary. She spent $30,000 of her own money on home health, and I told her I could help her get it paid. She's like, I don't have the time. Just I'll eat it. I mean, it's a pandemic in this country, and healthcare is expensive because we have a very expensive middleman. If you guys think insurance companies are saving you money, you're nuts. And the reason people think insurance companies save them money is because of stories like the one first person. Well, I got a bill for $75,000. There wouldn't be $75,000 bills if we were on a cash pay system where you walk in, you negotiate your own money up front. Patients will mind their own dollars better than anyone else. They'll decide what is necessary. They'll decide what isn't necessary. They'll decide where they want to spend their dollars, and they'll negotiate with providers to get what they feel to be the best price. That's how you bring down healthcare costs. But instead, these guys are stuffing their pockets, and they're stealing from patients, and they're stealing from the self-funded plans. They do it shamelessly in broad daylight, right in front of your face, because nobody knows what the hell's going on.
You're not going to gain any friends out of the show. You know that, don't you?
No, of course not. No.
So let me ask something.
I'll be getting out of healthcare soon enough, Steve, out of the provider side, and I'm changing.
So not everybody is lucky enough to have you as a doctor. What do people do when they talk to their doctor or they talk to the administration? They're going to have surgery to make sure that they're covered.
The best way to make sure you're covered is you have something in writing that is it's called a pre-service claim request, or the more common term is authorization. And the problem is that you can only get an authorization if your insurance requires one. Think about how dumb this is. Let's say the insurance says no auth is required. You call up and hey, I just want to know, are you going to cover this for me? Is this covered? Can you tell me? I mean, you're literally begging them to give you the answer, and they're like, no, we can't tell you because we don't require one. That smells like funny to me, and it should smell funny to you. So you can add. So it's the insurance company's decision whether or not they require authorization, but you want them to require it, because if they do, then they're going to tell you before the services are rendered whether or not they deem it to be medically necessary. At least you cannot be denied for that reason.
Wow. This is insane. I mean, it's bad enough how expensive health insurance is and how expensive health care is. and then you find out something like this.
Yeah, there's a lot
Feel
of
like
game.
feel like I've been ripped off.
Yeah, they do it all the time. They nickel and dime providers on their claims. Doctors write off tens of millions of dollars in monies that should be paid for covered services that should be covered because they don't have the time, energy, knowledge. I mean, if you think your doctor knows what I'm telling you, they don't. If you think the staff that works for them knows what I'm telling you, they know 1% of what I'm telling you. They know about authorizations. The problem is, it's like my mom had a friend in the hospital. Okay. Uh, he's diabetic, kidney failure, on dialysis, had a stroke in the hospital after a heart procedure, needed long-term acute care. My friend is a physical medicine physician, told me he needed inpatient rehab. He needed rehab in a controlled environment, not at home. Doctor said he needed it. The doctor at the facility he was at said he needed it. Then supposedly the facility he was at tried to get an authorization and it was quote unquote denied. Now, the problem with that whole story is we don't even know what the hospital sent to the insurance to even decide whether or not this guy would benefit from inpatient rehab. Okay. So then, my mom hears he's denied and he's like, oh, the insurance company is, well, it could be their fault, or it could be that the hospital was too lazy to put together a good, comprehensive letter with supporting evidence that would, support the need. How do you know maybe they just called up and gave them a code and said, will you provide, they don't want to spend the time. Maybe the facility that you were going to go to is not one owned by the hospital. So now they have no financial incentive to get you approved. But if you're going to their inpatient facility where they were going to make all the money, then maybe they'd be more incentivized. Not maybe. It's common sense, Steve. They would be more incentivized to work for you to get that approval. But if they're not going to get anything for it, why would they spend their money and their time when they could work on another claim that would earn? I mean, I'm just telling you the way it is.
Oh, that makes sense.
Money makes the world go around. So again, that's why patients need to empower themselves. I would be like, I want to see the documentation that you sent to the insurance to attempt to obtain that approval. You see what I mean? That's where the devil is in the details, Steve. The devil is in the details, and you're entitled to see all of the things that I'm talking about. The patient is entitled to see what was sent from the hospital to the insurance, what was sent from the insurance back to the hospital, every single document, every sheet of paper, everything they're supposed to show you by law. You're right as a beneficiary, period.
Well, we are going to replay the show for the entire United States on Monday. You told me that this show is going to basically blow me away, and it has. Um, I am so grateful that you've shared this information.
Well, it's a bit,
When do you think you're going to have the app?
It's a bit self-serving because eventually I'm going to advertise my product.
When do you think you'll have the app?
Maybe realistically 3 to 6 months. We're going to do it in stages. So right now we're doing a simple model, and then after we nail the simple model down, then we're going to grow. I mean, it's going to be like an organism. It's going to be like a child that we have to grow and teach and perfect, because each one of these denials has certain strategies and things that you need to know. There's always the basics, but the beauty of claims and appeals, Steve, is that once you learn the process, you can apply it to every single claim for your whole life, for your whole family, for all your friends, over and over and over again. And the insurance companies are not used to dealing with somebody who knows what they're doing. That's how they take advantage of that. People need to get out of the mindset that we're dealing with the mafia here, okay? And they think they have all the power. But when you know the law, again, you guys need to go read 29 CFR, which is Code of Federal Regulations, 2560-503-1. It's not that hard. Read. There's probably seven of the letters. There's like A, B, C, D. It's an outline format. There's probably 7 letters you have to know to know what I'm talking about, at least to get the basics. It's so empowering to write an insurance company telling them what it's going to be, not asking them what it's going to be. It's
Well, it
very,
sure pissed off Luigi. I mean, that's not the way to go about doing it, murdering the CEO of United
that's
Healthcare.
just
But
the culmination of the frustration
yes,
of what this country's healthcare has come to, and most claims are paid and done, and I get it, but there's a high percentage that aren't, and they're getting rich off that high percentage at the expense of everyone else, period.
Dr. Joe, thank you so much. Like I said, we'll be replaying this show at 8 o'clock Central Time on Monday
People
throughout
need
the
to
country.
give me specifics if they call in or write in get the best thing would be to scan your EOB and display it for at least you to read or me to read, so I can look at the actual fact, and then you can get a good answer. You need the explanation of benefits to get an answer of what's going on, at least the starting point. Unfortunately, I went here and this happened, I got that. That's not going to really allow me to educate, effectively, because the information is ambiguous.
Understood. Dr. Joe, thank you so much.
Have a good day.
Take care. Hey, that's going to do it for us today. What an incredible show. We'll see you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.